Hello, my name is Dr. Sourav Das. I am a consultant psychiatrist with Somnos Sleep Clinic. I am also attached as a visiting consultant with Medica Super Speciality Hospital Kolkata and Iris Multi Speciality Hospital Kolkata. I work as a consultant psychiatrist dealing with various kinds of patients, including those suffering from schizophrenia. And I do deal with general adult psychiatry, particularly those who have various kinds of psychotic disorders and addictive disorders in my routine clinical practice. Coming to the health risks of people with schizophrenia, we have to understand that a person, when he develops schizophrenia, his entire reality gets changed. Lot of unreal things appear very real to him, and as a result and consequence, his behavior and actions become very different to that what is expected normally from him. Now, due to that, what happens is that some of the people having schizophrenia, they tend to smoke more, they tend to use cannabis more. This has been found in research studies, and this increases to the huge amount of health risk factors associated with smoking cigarettes like tobacco or cannabis. Like the person has a higher chance of developing lung cancer, higher chance of developing cardiovascular diseases, and a lot of other things. Also, because their work and productivity gets decreased or stopped, their social status gradually keeps on declining. They start getting poorer and poorer, and as money goes out, lots of stresses and other burdens come in, and that leads to poor health seeking behavior, poor healthcare utilization, and a lot of other things, which gradually increases the person's chances of developing all the diseases at a higher rate than the general population. Another very important risk factor of persons with schizophrenia is the risk of suicide. The action of attempting suicide is very common nowadays in our society, but those with schizophrenia, they have a much higher risk compared to the general population of not only attempting but also completing suicide. Because you see, a person is hearing voices, and the voice is asking him to end his life now, then and there, and commit suicide. Then the person will not, while the person is having schizophrenia, his thought process is altered. He will not be able to think clearly, and he can attempt the suicide in a more rigid way, or and a more more strong way than that of a general population. For example, a person is having a relationship breakup with the boyfriend, and the lady wants to end her life. She can attempt, but while attempting, she will think that okay, it can be painful, I may die, and what will happen if I actually die, what will happen to my parents. So she can think all these things while being very emotional and wanting to end her life. So there are hesitations. So the hesitations, and the attempt finally does not become that much serious often. But on the other hand, a person having schizophrenia, that his entire thought process is altered, and when he can hear the voices continuously telling him for 24 hours loudly that you should die, 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 you are worthless, you should die, die, and at that point of time the person loses control. He has nothing restraining him from committing the act. The person wants a release from all this trauma and this stress and this intense fear, and the person commits suicide. So suicide is a very important consequence and risk factor of schizophrenia. Apart from that, there are definitely, since productivity is lost, they spend their times mostly lying around in their homes and not working. So all the other diseases like obesity, hypertension, diabetes, these again tend to be higher in people with schizophrenia. So that is all for today. We'll meet again. Thank you.